Good morning and good afternoon, everybody. We're back again for another MedFit Education Foundation webinar. I am Brian Prendergast, your host for today, and we have a very timely on-calendar topic here for the webinar today. Sleep for health, tips for daylight savings time, and always we're presented by Dr. Kelly Benyon today. And we're excited for that. As mentioned, daylight savings time is coming up, so we need to be ready. Welcome back, Dr. Kelly Benyon. Dr. Benyon is an assistant professor of psychology at Cal Poly State University in San Luis Obispo. Her research uses a combination of behavioral, eye tracking, overnight sleep monitoring, neuroimaging, and approaches to understand the effects of sleep and stress on memory for negative and traumatic experiences. It's exciting work. It's something that I've found myself down the rabbit hole once or twice on this very topic. So without further ado, we'd like you to take it away. And Dr. Benyon, I'm going to share the screen with you now. The floor is yours.
Great. Well, thank you so much, Brian. It's such an honor to be here. I'm really excited to be sharing about daylight savings time, just tips that we can use for this change that we're about to undergo on Sunday, but also some general tips that will help us really optimize our sleep and optimize our performance. So we're excited, Dr. Kate Sprecher and I, to launch our Sleep Coach Specialist course later this spring. So this is just a preview of some of the content that we'll touch on, but of course we'll go into much more depth on that later on. And before we get started, I thought I'd share just a little anecdote about my experience with daylight savings time. So I actually grew up in Scottsdale, Arizona, Arizona doesn't follow daylight savings time. So it wasn't until I was about 18 years old when I experienced my first change. And I actually remember staying awake, until, I didn't quite make it. I tried to stay awake to see what would happen to the clocks and what would happen to cell phones and things like that. But daylight savings is relatively new to me, I think, compared to people who do not grow up in Arizona. So it's certainly a topic I think about a lot, just being a sleep researcher, and I'm really excited to share with you some tips. As far as what we'll discuss today, we'll first just share a little bit of information about daylight savings time, so specifically the risks of springing forward. We'll talk a little bit about the neurobiology behind those risks, specifically looking at our circadian rhythms. We'll also talk about very practical tips on what we can actually do this week in order to prepare for this change that is about to happen on Sunday, ways that we can ease into it so that it's not so dramatic, just that one day, which of course is the way we can minimize accidents and changes to our health, and then some tips involving avoiding stimulants and alcohol, really controlling your light exposure. That's always a huge one, and that has to do both with our sunshine and natural light, as well as our artificial light, like our cell phones and our computers. And then later on, we'll talk about how to optimize our sleep. So this is something we should really be thinking about always, and not just, surrounding these changes with daylight savings time and standard time. So discussing our light, caffeine, melatonin, napping and sleep banking, and then also just touching briefly on some sleep disorders. So moving on, talking about daylight savings time, and Brian, feel free to jump in. I know my lights automatically shut off in my office, so if I need to turn those on, let me know. But we'll start out just with a little bit about the risks of springing forward. So what we know is that daylight savings time for this year will begin at 2 a.m. on this upcoming Sunday. So like Brian mentioned, this is a very timely webinar. And, I imagine that many of us are very familiar with just feeling grumpy about losing 1 hour of sleep. And, you know, of course, it's a little bit painful, you know, feeling like, you know, we've lost that hour, but it really is about so much more than that. So if you look at the data surrounding the spring daylight saving time transition, what we see is that unfortunately there's a marked increase in fatal traffic accidents by 6% in the US in the first few days after the transition. And this risk is highest in the mornings and in time zones that are further west. And, you know, I'd like to highlight the fact that we see this risk of fatal traffic accidents go up in the first few days, not just the immediate first day. And that's because it takes us a while to adjust to these changes. And we'll elaborate more on that later. So approximately 28 fatal accidents could be prevented yearly if this transition was abolished. And I know that this is something, we were just talking about this briefly, that some states are voting to do to really avoid this change twice a year. Can make a huge impact for the better. And what we also know is that shifting to daylight savings time has been associated with increased cardiovascular morbidity, including heart attacks, greater heart rate and blood pressure, and hospital admissions due to acute atrial fibrillation. So there are big changes that we're about to encounter just with losing 1 hour. So again, it's much more than, you know, feeling like you need to power through the day or adjust like that 1 day of sleeping. And we'll talk about how to prepare for it. But generally, this whole concept, the reason why it's so important is because our bodies are meant to operate on a 24-hour cycle. We are meant to follow our circadian rhythms, which we'll also elaborate on. And what we really want to attempt to do is align our body clocks and our social clocks. And social clocks meaning, you know, at what time of day are you typically doing things? What time are you waking up, starting to have meetings, eating your meals, socializing, things like that. All of the things that we do throughout the day, we ideally want to align that with our circadian rhythm or our biological clock. And when that is misaligned, which happens in some circadian rhythm disorders, which we'll also talk about, this misalignment is associated with decreased life expectancy, shortened sleep, mental and cognitive problems, and also sleep disturbances in our society that cost roughly 2% of the GDP. So this is not only something that impacts health. I imagine we're primarily here because we want to really focus on how to optimize our health and optimize our performance. But this is actually something, you know, that carries significant risks that, you know, are not only about health, but are also financial. Our judgment and decision making is significantly impaired when we're not aligning our, you know, our work schedule, our social clocks with our circadian rhythms. And this is probably something that you've felt before, you know, just feeling foggy when you're tired, and these types of decisions can have a huge impact in every area of life. And lastly, I alluded to previously how it takes us a long time to recover from these things. So some studies, and particularly one that I've cited here, has shown that our body clock doesn't adjust to our daylight savings time social clock even over months. So that's just one reason why it's so critical to really prepare for this shift. And this webinar is just at a perfect time because we can talk about what we can do in these next 4 or 5 days to make this transition much better and to really enable us to feel empowered about this shift, so that we're not dreading it, and rather so that we can really preemptively shift to the point where, you know, we're not even really considering it as something that has to impact our day-to-day schedule. So moving on to, why are there such risks of this? This has to do with our circadian rhythms, which I have talked about briefly before. So essentially, this transition that we're about to undergo on Sunday, this transition from standard time to daylight saving time, contributes to misalignment between our circadian biological clock and our light and dark cycle. So specifically, there's a very small part of the brain that's called the suprachiasmatic nucleus, and I've circled it here. You can see it's just a very, very small part of the brain. It's actually within another part of the brain called the hypothalamus, which many of you, particularly if you've been attending other webinars or you're a health professional, most of us might be familiar with the hypothalamus because it is the H when we talk about the HPA axis and our stress response. But another very important function of the hypothalamus is that within it lies this suprachiasmatic nucleus, which is a physical biological clock. And I say that because you can actually exchange tissue from, say, our suprachiasmatic nuclei. We're entrained to a 24-hour cycle. And if you exchange tissue from ours with an organism that, say, runs on an 18-hour cycle, those organisms would switch. We would start adopting that 18-hour circadian rhythm. So it really is this causal physical part of the brain that impacts why we feel alert when we do and why we start to feel tired when we do. And any sort of shift, particularly a dramatic shift, negatively impacts our circadian rhythms. So for any of you with maybe you spoke Spanish growing up. I actually majored in Spanish. You might remember the word cerca, like cerca day. So-and-so, like near, meaning near or close to. And then, so it comes from circa and dias, meaning day. So our circadian rhythm is roughly 24 hours. And what this means is that there are a number of physical, mental, and behavioral changes that follow a 24-hour cycle that's determined by this suprachiasmatic nucleus. And this is just an example to show how wide-ranging our circadian rhythms are. So it really isn't just about whether we feel alert or whether we feel tired. I think that's where, we're very attuned to it, waking up and, very easily recognizing, okay, I absolutely didn't get an appropriate amount of sleep last night. But as you can see here, there are a number of physiological changes that occur throughout the day, and it is all aligned with this 24-hour circadian rhythm. So really what we want to be doing is going about our day in a way that's really mindful to our circadian rhythms and to also align our social clocks with ideally what we should be operating in, which is where, if you can imagine, going camping for a while where you're exposed to very dim light in the evening as the sun starts to set. Before the advent of artificial light, that's really how we were supposed to function, where the sun rises in the morning, our melatonin secretion stops. This helps us feel alert. It signals our wake, and then we reach this high alertness, and then eventually over the course of the day, we start to fade. But you can see here, again, it's not just about alertness. You see that our blood pressure is tied to this, the likelihood of a bowel movement, testosterone secretion, our cortisol levels, which is our stress hormone, coordination, reaction time, strength. So many things are tied to our circadian rhythm, and we will function most optimally if we try to really maintain this 24-hour cycle where we are exposed to a lot of sunlight during the day, and then we let that taper off in the evening, which I recognize is very, very challenging to do depending on, potentially your job, family responsibilities, other responsibilities. But it's something that I think we all can take small steps to be a bit more mindful of. So now I wanted to jump into some practical tips for what we should do to prepare to spring forward. And these tips start as early as tomorrow. So I hope that for those of you watching live, you can try to take this to heart, try to figure out, okay, what should I be doing this week? So ideally what we want to do is try to gradually adjust to earlier bedtimes and waking times. So what we would want to do tomorrow is to go to sleep and wake up 15 minutes earlier than we normally would, assuming that perhaps you have some sort of regular sleep schedule. Having a steady sleep schedule is also something that is really helpful, just having that consistency there, also associated with positive health outcomes. So then on Thursday night, what you would do is you would shift that back by another 15 minutes. You'd go to sleep and wake up what would be like 30 minutes earlier than your average, like leading up to this week. Then you would keep doing that. So Friday night, you would now be at waking up 45 minutes earlier than normal. And then Saturday night, when we need to make this change, we're back at the point where, now we shouldn't feel the consequences of that lost hour of sleep because we've been gradually preparing for it. So I hope that some are able to take this to heart. I know it's something that's been on my calendar for a little while. So yeah, wishing you all the best with this. Another really important tip, and this is something that can be applied throughout the year, is to really pay attention to your stimulant use and alcohol consumption, and particularly in the late afternoon hours and at night. So specifically for this week, I would try to the extent that you can, really be mindful of your schedule, your caffeine consumption, and if you're someone that regularly drinks coffee or caffeinated tea, or if you're someone who uses stimulants. So nicotine is classified as a stimulant, so it should be treated very similar to caffeine. I would attempt to have your last cup of coffee or any sort of stimulant use. I would avoid that for the 6 hours prior to bedtime. And with all of this, it's really important to recognize that there are a lot of individual differences that you might want to take into account. So I think 6 hours is a really nice kind of average where you might want to start, but you probably have some idea of how long caffeine tends to affect you or how long stimulants tend to affect you. So with that, I'd try to listen to your own body. This is also something that I'd encourage you to keep a log about as you move forward. So not just about daylight savings time, but really trying to pay attention to, okay, when should I be having my cups of coffee so that they can help me feel alert, but they don't interfere with my nighttime sleep. And then additionally, you'll also want to avoid alcohol late at night, as there's very, very robust evidence showing that alcohol prevents quality sleep. So specifically, it depletes our rapid eye movement sleep, which is really important for learning and memory, creativity, problem solving, insight, our ability to regulate our emotions and manage our stress. So, some of you might be thinking, like, avoiding alcohol, like alcohol is one of the things that can help me get to sleep. And, the reason that is because alcohol is classified as a depressant. So essentially what it does is it inhibits our central nervous system or our neuronal firing to the point where it does slow us down and we start to feel lethargic. But unfortunately, the quality of sleep that we're getting, especially with excessive alcohol use, is very, very poor. So you are not you might not be able to sleep for the entire night. You also will not be getting quality sleep that is really important in allowing you to function optimally. Another tip specifically for this week, but truly always, is to expose yourself to sunshine right after waking. And it's understandable if you don't have, a lot of natural light where you are, or perhaps you need to wake up earlier, even earlier than before the sun rises. So we'll talk later on about some lamps that you can buy that are meant to mimic sunlight. But the reason this is so important is because light is the most powerful Zeitgeber or time giver. And what this means is that light has the power, and it does each day, to reset our circadian rhythms. So it really helps keep us on track with that 24-hour cycle. And with this, it can also help just give us a boost in suppressing our melatonin production. So essentially, if you wake up and expose yourself to sunlight, you're essentially telling your body, okay, we should stop producing melatonin. Melatonin is a hormone that's naturally produced that helps us feel sleepy. And you're telling your body, okay, stop producing melatonin right now. Like, it is a new day. I am ready to attack whatever I have going on today. And that can be very beneficial just to help entrain our circadian rhythms. It can really help us over the next few days following Sunday to get us on this new schedule so that we're not kind of living in, what was a pre-daylight savings time, like living in standard time, even though we have to make all those changes to our social clock. It can help expedite this transition, which will be really beneficial and help minimize, the accidents that we talked about before, along with that gradual transition that we should be doing to start off. And then the last tip that I have specifically for this week, but again, it's one that always applies, but we'll talk about some more just longer tips that we should be following and really making a habit just in the next section of this talk. But for this week in particular, because what we want to do is gradually start to go to sleep earlier and earlier, you're going to want to put your phone away at least 30 minutes, or better yet, an hour before bed. And this is critical because I've mentioned, this hormone melatonin that helps us feel sleepy. And the reason why phone use before bed is so awful is because our phones and technology emits blue light, which is actually the most harmful wavelength of light for our melatonin production. It's very high frequency. And the blue light in particular suppresses our melatonin production. So essentially what we're telling ourselves, what we're telling our brains and our bodies, if we're laying in bed just staring at our phone, scrolling through, whether it's the news or social media or anything else, we're really doing a disservice to ourselves, because we are essentially telling our brains, okay, don't produce melatonin right now. Like, I need to be alert. This is a time when I should be focusing on whatever I'm reading. And so that's especially going to be important this week because, as we previously mentioned, you want to shift your bedtime earlier and earlier, and doing something not only like staying off your phone or making sure that you're not watching Netflix, but also ideally, if you have the control over your environment, you should be trying to dim the lights, sort of mimicking the sunset. So as the sun starts to set, can you switch to, if you have a dimmer switch installed, can you just gradually dim the lights so that you're not suppressing your melatonin production for those hours before bed? And light at night is a big part of the reason that we don't get enough sleep. And short sleep, even though we're not really talking about sleep deprivation here or sleep restriction where you're only getting, say, like 4 to 6 hours a night, short sleep is linked to depression, diabetes, cardiovascular problems, and more. So sleep deprivation is a really serious problem because, again, it's challenging for us to do this, but it's really important to disentangle just these short-term consequences of sleep deprivation. So, maybe you're a little bit grumpier, or you find it harder to focus or harder to power through the day, but it's really those chronic long-term consequences that you want to make sure that you're avoiding, which is why we should really prioritize and schedule our sleep. But on the note of light exposure, so many people who have trouble sleeping, and this might even be the case for many of us here, which is, we'll try to go to sleep earlier and earlier to prepare for the transition on Sunday. But if we're not also dimming our lights and making those changes, then unfortunately what happens is, we are exposing ourselves to bright light all the way until the very late hours. And then when we lay down and our head hits the pillow, we're often surprised, like, what on earth? I was exhausted all day. Like, why am I so awake right now? But it's because that light exposure in those hours before bedtime, we've essentially been suppressing our production of melatonin. So when we lay down, even if we may have had a really exhausting day, we don't have those melatonin levels to signal to us that it's time for bed. So moving along, now we can talk about, what strategies can we always use and should we always use to optimize our sleep? So the first one here is to control our daily light exposure. And I'm sure you are not surprised that this is listed first. And as previously mentioned, light is the strongest signal to keep our circadian rhythms synchronized to the 24-hour day. So in a really optimal world, we would expose ourselves to bright light in the morning. So, open those curtains, make sure that you're signaling to your brain that it's time to start a new day. We would get strong sunlight during the day. Then, as discussed, we would get dimmer light in the evening and then darkness at night. And this darkness is really important because even just the smallest amount of ambient light, so such as, that light that's emitted when your phone reaches full charge, or street lights that might be like peeking in through your curtains, even that small ambient light, if we are not feeling like our sleep is affected, does have the ability to interfere with our sleep quality. So there are a number of tools that we can use to really help us be thinking about light. So the first is to think about blackout curtains. So specifically, really trying to black out all of that light at night. And you can do that, not only with curtains, but also just being mindful of, where are the small LED lights in your home? And is it possible to cover those up with tape, for instance, like electrical tape, assuming that you don't need it for safety purposes, making sure that you don't have devices like TVs that are on during the night. A tool can be opening the curtains, like really making sure that you're exposed to sunlight, especially in the morning, but then also during the day. There are also sunrise alarm clocks. I used one of these for many years. I put it away for a little while, but sunrise alarm clocks are really effective in allowing your alarm clock actually to mimic the sunrise. So you may or may not be waking up with the timing of the sun, and this might be especially true, in different seasons. But what sunrise alarm clocks is they allow you to choose a time and even some sort of window of time where this light, which effectively is your alarm clock, will gradually rise and get brighter, mimicking the sunrise for a set number of minutes that you can adjust. And that allows you, one, the really pleasant feeling of you waking up with the sun, but it can also stimulate just this the suppression of melatonin, like when it is time to wake up. And then some of you might be thinking, I have to wake up earlier than the sun, or just generally I don't get a lot of light exposure. So you may have heard of seasonal affective disorder, which is a disorder that affects many people actually, where rates of depression are higher typically in the fall and winter when there is less light. So there are specific lamps for seasonal affective disorder and light boxes, and you can also use full spectrum lighting. So this is a fluorescent light that is the full spectrum of visible light that is meant to mimic the natural sunlight. So if this is something that you feel like you're very impacted by changes in the season, or when it's dark out, or even if you live somewhere like Seattle where it might be a little bit more gray, this is something that you might want to look into. And then lastly, the more light you can expose yourself to, by being outdoors. So you could think about not only your bedtime routine, like putting away your phone, but what is your morning routine? Could you make part of your morning routine waking up, opening the curtains, taking a quick walk outside? And that can really help you control your daily light exposure. All right, our next tip is to use caffeine as a tool, not a crutch. So caffeine can be a really amazing tool. It is, for the most part, safe if you are using it appropriately, around 200 milligrams per serving, not drinking excessive amounts of caffeine, like certainly not drinking energy drinks. But it's important to note that caffeine sticks around. So what some of you may have already realized is that if you consume caffeine too late in the afternoon or the evening, then this can actually impact your ability to fall asleep, which could be especially problematic if you're someone who suffers from insomnia or you have a lot of trouble falling asleep. But typically you see peak effects of caffeine within about 30 to 60 minutes. And caffeine has a half-life of about 3 to 5 hours, but the ability to kind of rid ourselves of the effects of the other half take often much longer. So this is something to be really mindful of. I think, again, I mentioned keeping a log. That's one of my best tips, especially if you have the time to really think about, how can I optimize my schedule? I know a lot of us during the pandemic have kind of shifted to differences in work life, like maybe you can work from home. Maybe now we've adjusted to the pandemic and you can figure out maybe you have more flexibility. So if you do have some additional time, and even if you feel like you don't, this might only take like an extra 5 minutes a day, but I'd encourage you to keep a sleep log where you mark when you tried to fall asleep, like a prediction for how long it took you to fall asleep, when you woke up, and then perhaps your alertness ratings on a scale of 1 to 7 every couple hours throughout the day, as well as your caffeine consumption, your alcohol consumption, sunlight, exercise, these things that are known to dramatically impact sleep and alertness. I would try to keep a log of those so that you really understand, what is best for your body, and paying attention to, like, okay, I need to stop drinking caffeine at 2 p.m. every day. Anything after that just won't work for me. Knowing that could be really huge and truly life-changing. And then additionally, Dr. Sprecher and I wanted to share an app that the U.S. Army very much utilizes called To Be Alert. And what this does is it suggests a schedule of dosing and timing of caffeine to support a desired schedule of sleep, wake, and peak performance. So essentially what you can do is you can identify, like drag in what are your typical peak times. You can indicate, what your caffeine exposure looks like. You can generate optimal schedules, and it will show you actually your alertness impairment depending on these decisions or these schedules that you're adopting. So particularly if you're someone that has a really high risk job, this could be a really great tool so that you can figure out, okay, I should consume caffeine at these times in order to really figure out like when I'll be at my peak alertness when I need to be. So this is something that I know you have a handout of the slides. This link is right here, and it's very, very fast to just log in and register to create an account. And then lastly on caffeine, it's important to note that caffeine is not a substitute for sleep. So there are peer-reviewed journal articles and studies just showing, there certainly are limits to where caffeine can rescue your performance. So specifically there's one study showing after 5 nights of sleep restriction, the effects of caffeine and actually enhancing your alertness hardly work. So there really is a limit. This can't be something that you should try to use consistently to try to rescue you throughout, and rather I'd try to focus on ways that you can prioritize and protect your sleep, and think about how you can schedule it and modify some other like changes to your habits so that you're not just always relying on caffeine, because caffeine is something that we do develop a tolerance to, and eventually it will become less effective for us. So I've touched on melatonin. Melatonin is a hormone that's naturally released by the body to regulate circadian rhythms, including our sleep. And along with the circadian rhythm of melatonin, it rises in the evening and then it tapers off in the morning to signal the body that it's time to wake up. And the body's response to melatonin varies depending on what time you take it. And I'd encourage you to really play around with your melatonin use. So if you decide to take a melatonin supplement, which you can easily buy over the counter, it will give you instructions. Most often those instructions will say, take 5 milligrams before bed to help you fall asleep. Some might even say that it's safe to take like between 5 to 8 milligrams. But I'd actually, again, this is something I'd recommend that you log, not only how much you take it, but also the time before bed that you try to take it, because there are individual differences. And for some people, taking it 30 minutes before bed might be really helpful. For others, you might want to take it 1 hour before bed, or even 2 hours. And this might depend on your light exposure and your bedtime routine. So I would try to create a consistent routine and log all these factors to figure out, when should you be taking melatonin and exactly how much is the appropriate dose for you. And then just a warning about this, there are a lot of melatonin brands out there, but for trustworthy dosages, I would look for brands that have been certified by consumer labs, the US Pharmacopoeial Convention, or NSF International. So just some tips on, how to sift through all of the melatonin that's out there. Next, we'll talk about napping and sleep banking. So napping is a huge tool. It's great for a quick refresher. It's also great for you to recover your sleep. So if you have some temporary sleep deprivation, I would absolutely encourage you to try to nap, really try to get that into your schedule. It's a great way to recover lost sleep. So what's important to keep in mind with naps is both the duration of the nap, and also to some extent, the time of day, but the duration is really critical, because I'm sure you've all had the experience where, your alarm goes off after a nap and maybe you feel so much groggier when you wake up that you're like, oh gosh, like I should have never napped in the first place. I feel worse than I did when I started. And when that happens, it's likely that your nap has actually been too long, and that, so looking at this bottom bullet here, and that you have fallen into deep sleep. This is when our body temperature is at its coolest, our brain waves are at their slowest. You have this really strong sleep inertia where you just really want to stay asleep. And it takes a while to recover from that. So if you know that you have something really critical going on, or just if you don't like feeling groggy, I would keep that nap to about 10 to 30 minutes. Anything less than that won't give you that cognitive and mental boost, these boosts where your alertness will be improved, as will your physical and mental performance and your mood. So I'd say, 10 minutes minimum if you're one of those lucky people that can take short naps, or 30 minutes at the most, but really trying to avoid that, say, like 45 minutes to an hour range, which I think is a really common nap duration, but unfortunately is one that's very likely to keep you groggy. An exception might be, if you have really lost out on sleep, like let's say you have a red-eye flight or you have a newborn and you haven't been able to sleep, but you have a big chunk of time, then you should strive for a full sleep cycle, which is about 90 minutes. There's also a new concept, relatively new, called the caffeine nap, or a nappuccino is another name for it, where you take you have coffee or a caffeine pill just before your nap. We talked about it taking about 30 to 60 minutes to see those effects of the caffeine. So it won't impact your ability to fall asleep, but it will, because you're hitting, that 30-minute mark, it will reduce grogginess when you wake up from that nap. That's about exactly how long, if you take a 30-minute nap, that it might take for the caffeine to actually take effect. And this can be especially useful if you need to be immediately alert upon waking, like emergency pilots, or you try to sneak in a quick nap right before a Zoom meeting, things like that. All right, and we'll turn now to our last section, because I imagine many of you here, might not only be interested in daylight savings time or general tips for healthy sleep. Some of you might be thinking, my sleep issues might be indicative of a sleep disorder. So I wanted to make sure to at least touch on this briefly. So one, and the reason I'm starting with sleep apnea is because it is a really common disorder and one that has really tried and true treatments. So if you are waking up feeling unrefreshed, and let's say you slept for 7 hours, but you wake up and you're like, oh, I don't feel like I've nearly slept, what my alarm says that I did, or what my app, if you wear like a Fitbit or something like that, what my app says. It could be because you have sleep apnea. And if you're a loud snorer, I'd especially take this information to heart. So in apnea, you have repeated breathing pauses during sleep. So this leads to awakenings and low blood oxygen levels. It also prevents our ability to enter deep sleep, which is our most physically restorative stage of sleep. And there are many complications with this, such as daytime sleepiness, heart issues, diabetes, and high blood pressure. So with this is something you'd want to, if you're like, oh, this describes me, I've always been a loud snorer, or I'm snoring loudly recently, I would definitely talk to a physician, and then they might refer you to a sleep study. That now a lot of sleep studies are done at home, so you often don't even need to go into the labs and have sleep in a strange environment, have someone affix electrodes to your scalp. So I would definitely encourage you to get a sleep study. And the tried and true and really effective treatments are mouth guards that can help push your jaw forward and open the airway, as well as a CPAP machine, and this stands for continuous positive airway pressure, and this will help keep your airway open. An additional tip is that it's better to sleep on your side than on your back. So anything you can do, to prop pillows up behind your back. There are even special mattresses and pillows made to help people sleep on their side. So that's another thing that you can try as well. So now insomnia is somewhat of a catch-all term, and this is when you have difficulty falling asleep or staying asleep. And I'd say it's somewhat stigmatized and largely underdiagnosed because of that reason, but I imagine that many of us may feel that we have trouble falling asleep, staying asleep, maybe waking up early and feeling unrefreshed, having trouble falling back asleep if you wake up in the middle of the night. Those are all symptoms of insomnia. So it really impacts a lot of people and is associated with tiredness, irritability, difficulty with attention, accidents and mistakes. And this is because sleep is so critical for our ability to focus, pay attention, as well as a number of other really positive benefits. Insomnia also, to diagnose it, that would be made by a physician or a psychologist, and then based on a physical exam and medical history. And with this, there are a lot of treatments. One of the, something I'd try first is to just try to really increase sleep hygiene and improve it. So a lot of the tips that I've shared today, you can make changes to your lifestyle that are truly life-changing. So I'd consider, adopting these tips, especially those ones that we talked about leading up to daylight savings time, but continue them beyond. Address anything that might contribute to why you can't fall asleep. Our stress and sleep, and this is largely what I study and what I did my PhD in, are very, very tightly related. So trying to minimize stress, trying to minimize or, really process big life changes, and then also addressing any medical conditions or medications that might impact sleep. And then additionally, cognitive behavioral therapy for insomnia is very, very common. And one of the big tips that I think that is somewhat counterintuitive for CBT for insomnia is one of the worst things you can do if you're having trouble sleeping is to just stay awake stressing about how you're having trouble sleeping. So if you wake up in the middle of the night and can't fall asleep, you should actually remove yourself from the bedroom, try to find somewhere comfortable to, relax, and then return to the bedroom when, you feel a bit more tired, because you really don't want to associate or condition yourself into believing that, this bedroom is the place where I try to sleep, but I can't. So CBT is typically delivered by a psychologist that's qualified in behavioral sleep medicine, but there are also some apps available. So Sleepio is one of those apps, and this is an app you have to pay for, but essentially, like, you will put in your goals, you'll fill out in-depth questionnaires, and then you have access to a sleep coach. You also have a customized program based on your goals. So I'd encourage you to check that out if you're like, oh, that's something that might work for me. And then additionally, a physician might prescribe some sleep promoting medications, or, perhaps melatonin supplements. And then now turning to circadian rhythm disorders, really kind of wrapping it up back where we started with the circadian rhythm. This is when our circadian rhythm is out of time with the environment. So examples are shift work, jet lag. So if you frequently traveled, you might have a delayed or advanced sleep phase, like extreme morningness or eveningness, as well as when you simply do not operate on a 24-hour cycle. So again, with diagnosis, this might be done by a medical doctor or a psychologist, and is typically based Similarly, I've mentioned, keeping a log. Another word for that are sleep diaries. So you might keep a sleep diary for, X number of days or even weeks, and then also wear an actigraphy watch, which will monitor your sleep based on just your motion. It does a reasonable job of tracking when you're asleep and when you're awake. And there are so many disorders kind of looped into this that the treatments might vary depending on the disorder and the cause. But there are again, a lot of lifestyle adjustments and changes that you can make. I also would pay attention to your light exposure, and not only light, but also your timing of exercise, timing of eating, trying to get on a really consistent schedule. And that will just really help keep that 24-hour, all of the behavioral, physiological, hormonal changes really in sync. And then there are also medications like melatonin that you can take for circadian rhythm disorders. So with this, I'll just end with some top tips for optimal sleep. So we want to keep a regular sleep schedule, and this includes not only bedtime and wake time, but also when you eat. Digestion can also interfere with our sleep, like particularly if we're trying to digest a really heavy meal before bed. That might prevent us from reaching deep sleep where our body temperature should be at its coolest. Creating a relaxing bedtime routine, so that might include like mindfulness meditation, guided meditations, avoiding screens and technology before bed for at least that like 30 to 60 minutes, avoiding alcohol and sugary foods before bed as well, just really helping you prepare physiologically for sleep. Keeping the bedroom cool, dark, and quiet, so specifically sleeping at a temperature at or below 68 degrees Fahrenheit. Dimming lights 2 hours before bedtime to again help with that transition. And then we're hopeful that if you make all of these really small lifestyle changes, that you'll be able to use medications, including melatonin, even though you can buy it over the counter, really as a last resort. So with that, thank you so much for your attention, and I look forward to answering any questions.
Thank you so much. It was tremendous. I always get great information from you to use personally. Quite frankly, I'm a student in these webinars first and foremost because I'd like to get better, and I write questions as we go. So, but first, we did have a few from the crowd. Let's go towards the tail end of your presentation. You discussed sleep aids and melatonin and some things like that. What are your thoughts on CBD products for sleep aids? And I will even ask, maybe there's some products available in some states that may be along the same lines that might help us with that as well.
Yeah, absolutely. Great question. And thanks so much for your kind words about the presentation. So with that, I think the verdict is still out. A lot of the CBD products especially are relatively new, so I wouldn't say there's a ton of robust literature about them yet, but much like a lot of tools that are out there on the market now that can help promote relaxation and decrease anxiety, that's really where the benefit of CBD products and other supplements or potentially even drugs that are illegal in some states can really have a benefit. So I'd say, the verdict is still out on like perhaps what exactly the products might do to enhance sleep quality as far as sleep staging and sleep physiology is concerned. But like I mentioned previously, stress and sleep are very, very interrelated. So if part of the reason why one can't get to sleep is because of stress or anxiety or potentially pain, that's where I can see CBD products as being really effective, because it can help address like the stress, anxiety, pain, which is so tightly linked to our ability to sleep.
Okay. And I always kind of struggle with the the cart and the horse here, or the chicken and the egg when it comes to melatonin and insomnia, or you said it's a broad brush that insomnia paints with. And is it best to go to the sleep aids, the melatonin, in order to get the sleep, or is it better to kind of pinpoint why the lack of sleep is happening? What the issue is, the real issue. We could use melatonin as an aspirin, for pain, or we can kind of figure out what the pain is. What are your thoughts on that?
Yeah, I would recommend the latter, like trying to get at the root cause of why one is unable to sleep. And that can be a frustrating process, certainly, but generally I always recommend changes to habits and lifestyle, and even like mindset, like really trying to set up your bedroom environment as a place that feels conducive to sleep, like making sure that you've done things like take out anything that would increase stress in the bedroom, like your computer, or a desk, ideally, like if you have space to put anything associated with work elsewhere. I first would make those changes and then see, like, can you make enough small changes to the point where you actually find it easier to sleep? Can you try the weighted blankets, which also have been shown to decrease anxiety levels? Have you really blocked out all light in the room? I first would try all of that, because even though melatonin is a safe supplement, I'm just personally of the belief that we wouldn't want to rely on it if we didn't have to. And I really think there is a lot we can do with our habits and lifestyle changes that truly make a huge difference, that I think most people haven't exhausted all of those small things yet before turning to the supplement.
Okay, fantastic. So we are up against the hour, but I do have another question that I feel is a good one from the audience. So I want to get into that. David McCullough asks, why does it seem to take longer to adapt to daylight savings time than it does to adapt when we travel across 2 or 3 time zones?
Yeah, that's a great question, and one that I like because I travel across time zones very frequently. So with that, we are aided significantly by the fact that when we talked about this alignment of the body clock and the social clock, and one thing we haven't talked, much about, at least not on that slide, was that when we travel across time zone, we're aided significantly by the fact that the sun changes as well. So like we'll cross those 2 or 3 time zones and the sun completely changes, to the point where like we'll land somewhere and, let's say you take a red-eye flight to the East Coast, and your body might still feel like it's 3 or 4 a.m., but the sun is rising, so that light significantly helps us. With daylight savings time, in contrast, even though it's just 1 hour, the sun doesn't dramatically change. It's really us that we are changing everything about our social clock without having that help from the sunlight. And because light is so powerful in training our circadian rhythms, when we don't have that dramatic change of the sun, that's why it's so much harder to adjust to it.
Okay, fantastic. I have one last question, and I'm going to actually kind of combine 2 here. It's, what would the change in time to daylight savings time, who does it affect most? Is it the early riser? Is it the, is it the night owl? And with that, considered, how can we, as fitness professionals, look at the exercise prescriptions for those people that day, maybe adjust one for the, how we approach it for one party as opposed to the other?
Yeah, absolutely. So it'll depend on if we're looking at the spring or the fall, but for these spring changes, it'll impact the night owls more. It'll make it, it's harder for night owls to really try to shift and to go to sleep earlier. It will also affect adolescents really dramatically, whose circadian rhythms shift in adolescence. So in the springtime, it'll impact the night owls more, and the opposite will be true in the fall. So as far as prescribing exercise and changes, I would assume that particularly for that day, that if there's any way, like especially in like that day and the few days afterwards, to kind of assume that if someone is a really strong night owl, that they're kind of still living in standard time, and to try to really just still align exercise where those peak alertness levels like should be based on standard time, and kind of gradually start to bring it back over the course of a week or those few days afterwards. And that way you'll be much less likely to avoid, say, like injury because these hormonal changes haven't really happened yet, particularly like in that group of people.
Well, thank you very much. Everything it's fascinating work that you do. And I really, I find myself drawn to it from an athletic perspective, performance perspective, and sleep being the greatest, aid that we can have in recovery in that aspect. I look at it mostly from that standpoint, but just in day to day and getting along in this world with a better night's sleep, it's a very important thing. So Dr. Benyon, thank you very much for joining us again in such a fantastic presentation.
Thank you very much. This was so wonderful. And yeah, thank you for hosting, and thanks so much to everyone for being here.